So as we heard earlier this afternoon from Dr. Mellon, patient satisfaction and the patient experience is very critical to how we practice medicine in today's era. And not only that, but it is made available for all to see. So at Wake Forest, we use Press Ganey, and the comments that our patients receive are actually posted online so that anybody that's interested in potentially seeing you as a provider can read your reviews and see whether you would be someone that they would be interested in. So this is one of my reviews. Probably not my best, I would say, but I like this one because it represents several issues that we face in dermatology and to a large degree in medicine as well. So this patient needed an appointment, there was no access, they waited a long time to get the appointment, they had to jump through hoops to try and move up the appointment. They got to see me. It was probably a triple booked appointment, just based on my normal schedule. Couldn't spend a lot of time with the patient, and they may have felt like the visit was kind of all for naught because it ended up being something that was not a problem and was totally benign. This is a problem that we face in dermatology. It's a widespread issue within dermatology. And so I really feel like dermatology is very well positioned to employ telemedicine. And when you look at telemedicine in the outpatient setting, there's three main tenets of telemedicine. And the goals are really to reduce wait times, to improve access, and to increase patient satisfaction. So I really wanted to figure out how we could do that within our department at Wake Forest. And when you think about particular populations of people that may be at most risk for not having access to dermatology, our pediatric patients are among the highest risk. This was a study that I found very sad, actually. So this was a study that showed that children with Medicaid had a much less likely chance of being accepted as a new patient in a dermatology practice, and they had to wait twice as long as a child with private insurance. Now, at academic institutions, oftentimes we see a lot of Medicaid patients, and that's true at Wake Forest as well. But it just means that the access in general for our pediatric patient population can really stretch us pretty thin. So how can we improve access? We use Epic EMR at Wake Forest, and so we decided to pilot a kind of store and forward EConsult Teledermatology project. And so we utilized our smartphone devices. So Epic on an iPhone or on a smartphone is called Haiku. So there's an app for Epic, and on an iPad it's the Limerick app. And you're actually able to take patient photos through that application. And the photos are not stored on your personal device. They're actually directly uploaded to the EMR platform under that patient's chart. So we already had a lot of the technology in place for creating this type of EConsult teledermatology visit. So how this works is this is a primary care to specialist consult. So a PCP, whether it's a pediatrician, family medicine, or an internist, can select an EConsult within our Epic EMR, and they basically fill out a pretty short form. That's what's your question, and we ask that they take at least 2 photographs of either the rash or the lesion that they would like us to evaluate. So we have some instructions, as you can see down here on the bottom of this template. And they send it, and all of the EConsults come to me. So they populate in my in-basket in Epic, and I have 72 hours that I can respond. And I have a options. I can either review the chart and say, yes, this is something I can answer electronically and give them back kind of my response, or I can say, this really isn't something that I can evaluate through a telemedicine platform. This patient needs to be seen for a visit. So this was a patient that I was sent an EConsult that had suspected vitiligo. So this is a 13-year-old patient. And so these were the pictures that were sent to me through the EConsult. So I was able to look at them and say, yes, this does look like new onset, kind of localized vitiligo in this patient. And the PCP really just wanted to know, is this vitiligo, and are there treatments that I could go ahead and start for this patient? So this was a perfectly appropriate EConsult. So if this patient had called our office and wanted a new patient appointment, it would have been 3 or 4 months for us to be able to see them. So instead, they got a dermatologist to evaluate their skin, come up with a treatment plan within 72 hours. So this will be a response. So I respond to the PCP and I give them my recommendations for what to do to treat the vitiligo. And then another component of this pilot project is actually to provide some of education to the primary care providers as to why we are recommending what we recommend. And the reason for that is that the next time that this provider has somebody with new onset localized vitiligo, they may not even need to use an EConsult. They may now know kind of this is the first line standard of care treatment for this disease, and I can go ahead and prescribe that medication to the patient. So it's an access tool, but it's also an education tool for our primary care providers. And the way that Wake has structured this is that they actually attribute half of an RVU to me as the EConsult responder and half an RVU to the PCP. So a little bit of an internal incentive to try and utilize this program. There's no additional cost to the patient at all. So they do not get charged another copay. It's just their regular primary care visit. So this has actually been pretty successful, and we are now part of a larger double AMC core EConsult Initiative project. So they've actually piloted this similar project at over 30 different academic institutions across the United States. And what they find is that there's a very high % of primary care physicians that routinely use this EConsult service, and that the vast majority of patients that were seen through this EConsult platform did actually not need a specialist follow-up visit, which I think is really ideal in terms of cutting down kind of those unnecessary appointments and also conserving resources. I think one of the reasons that this project is pretty successful by and large is because it ascribes to the keep it simple, stupid concept. So it's a very short consult template that the PCP has to fill out, and it's pretty easy for us to respond to them in close to real time. So this has widely been a success. One of the other patient populations that I was really passionate about delivering some sort of telemedicine to was actually my initial population, and that's patients in the hospital. So this is Baptist. This is our main hospital that we have, and we have 24-hour-a-day inpatient dermatology access here. So we have an active consult service. We see several hundred new consults every year at Baptist. But in recent years, our network has really expanded, and now we actually have 5 different patient centers with which we deliver care. However, our main facility is the only place where we have access to inpatient dermatology consultation. And this, to me, is unacceptable. So I really would have a passion for inpatient dermatology and want to be able to implement teledermatology to all of these facilities. Because oftentimes what happens is if a patient with a dermatologic emergency is admitted at one of these other facilities, they end up having to be transferred to our main academic center for dermatology consultation. And oftentimes they don't need to be transferred. So we're trying to, in the inpatient setting, use telemedicine to accomplish a couple different points. We still want to improve access, so that's same for both of these pilots. But with inpatient dermatology, we also want to reduce diagnostic uncertainty, and I'll talk about that more in just a minute. And ultimately, of course, improve patient outcomes. So this is a graphic of roughly the number of new inpatient dermatology consults we get every year at Wake Forest. So it's around between 400 and 500 new patients that we see each year. And from our own internal institutional review of our inpatient databases as well as national data, what we know is that it's pretty consistent that about 2/3 of patients that are admitted to a hospital and have a dermatologic disease have a wrong diagnosis prior to consult with dermatology. So dermatology consultation actually changes the diagnosis and the management of these patients in 2 out of 3 every 3 patients. And this is why I think access to inpatient dermatology is so critically important in kind of our modern healthcare era. And we can also see that this has an effect on things like readmission rates. It decreases length of stay for patients with inpatient dermatologic needs. It can change their treatment. It can change their ultimate outcome. And there's a lot more literature that's being published recently about the impact and the need for inpatient dermatology to deal with these complex and critically ill patients. And so now that we have kind of successfully piloted our eConsult platform in the outpatient setting, the goal is to now move that to the inpatient setting as well and allow our hospitalists at our outlying facilities to be able to utilize that eConsult template in order to improve our patient care. And that's all I have. Thank you. Take any questions.